Bacterial gastrointestinal infection. Enteric bacterial infection causing diarrhea, dysentery, and enteric fever are important health problems throughout the world. Diarrheal infection are second only to cardiovascular disease as cause of death, and they are leading cause of childhood death. In developing countries, diarrheal disease accounts for 1.5 million deaths each year among children aged from 1 to 4 years. Important features or characteristics for most Enterobacteriaceae. Gram-negative non-spore forming rod. Most Enterobacteriaceae are motile with exception of common isolate Klebsiella, Shigella, and Yersinia. The motile strain pose peritracheous flagella. Many Enterobacteriaceae also pose virulence factor, Fimbriae, 6 villi capsule, and endotoxin. Facultative anaerobic. All membrane ferment glucose and reduce nitrate to nitrate. All members are catalase positive and oxidase negative. Escherichia coli, one of the most predominant intestinal flora, causes wide range of infection, include UTI, meningitis, wound infection, and bacteremia. Ferment lactose have characteristic metallic sheen on eosine methylene blue, positive in indole and methyl red, negative in Voges-Proskauer and Simon citrate test, does not produce H2S, usually motile. So, the result of INVIC test positive, positive, negative, negative. At least 6 different classes of diarrheal producing Escherichia coli have been identified. Number 1. Enteropathogenic Escherichia coli. Number 2. Enterotoxigenic Escherichia coli. Number 3. Enterohemorrhagic or virotoxin producing Escherichia coli. Number 5. Enteroinvasive Escherichia coli. Number 6. Enteroadhesive Escherichia coli. Number 7. Enteroaggregative Escherichia coli. 4 of them are common cause of diarrheal disease in developing countries. Identification of these strains require serological and toxicity assay in cell culture. Detection of diarrheogenic Escherichia coli strain in laboratory is difficult, complicated by the fact that non-virulent Escherichia coli strains are common present in the feces, stool culture or Makongi agar, and identification by PCR more accurate than biochemical and serotyping. No vaccine are available for all diarrheogenic Escherichia coli. The second pathogen from Enterobacteriaceae, Klebsiella pneumonia, usually found in intestinal tract and the frequent cause of nosocomial pneumonia. Ferment lactose, both a polysaccharide capsule, make the colonies mucoid and moist. Negative in indole and methyl red test, positive in Voges-Proskauer and Simon citrate. So, the result of INVIC test negative, negative, positive, positive does not produce H2S. According to Proteus, the most clinically important species include Proteus mirabilis and Proteus vulgaris, isolated from urine, wound, ear, and bacteremia. Do not ferment lactose and motile, produce swarming on non-selective media. Produce H2S according to urine positive test. INVIC result of INVIC test negative, positive, negative, positive. Salmonella. The genus Salmonella contain more than 2,000 serotypes. Many of these may infect both a human and domestic animal. In a human, they cause gastroenteritis, typhoid fever, and bacteremia. Usually begin with nausea, vomiting, abdominal cramp, and diarrhea within 8 to 48 hours after ingestion of contaminated food. The symptoms often persist for 3 to 5 days before resolving without therapy. Some patients may become carrier for 1 year or more. Laboratory diagnosis require culture and isolation of organism from blood, feces, cerebrospinal fluid, urine in acute and subacute cases, but in chronic cases, identification and isolation from bone marrow, gallbladder, healthy carrier. Presence Salmonella typhi only in stool without a clinical disease indicate often a carriage state. Selective culture media include Salmonella Shigella agar, Hecton enteric agar according to lactose non-ferment agar. Serological tests include Whittle test used for diagnosis of typhoid fever. That's measure level of antibody against somatic antiflagellar antigen. The rising titer indicate positive Salmonella typhi, especially in acute infection. Shigella species cause wide spectrum of clinical disease which vary from asymptomatic infection to diarrhea without fever to severe dysentery. Symptoms consist of abdominal pain according to bloody diarrhea. Shigella species are the main cause of bacillary dysentery. There are 4 groups of Shigella organisms with total 39 serotypes and subtypes are recognized in groups. 4 groups. Group A, B, C, D, including Shigella dysentery, Shigella flexneri, Shigella bodi, and Shigella soni. Shigella dysentery and flexneri are the most common. Also, the diagnosis. Acute diagnosis of Shigella include direct stool examination for the presence of blood cell, white and red blood cell, direct rectal swab or rapid stool culture of feces on special media include Salmonella, Shigella agar, and Hecton enteric agar. Shigella isolation and confirmation by some biochemical test and serotyping. Most persons develop non-protective specific antibody, no healthy carrier stage. Prevention concentrate on hygiene, control of water, milk, fresh food, vaccine use in endemic area. Laboratory diagnosis. Specimen site of origin must be considered. Gram stain not of value. Culture blood agar and selective differential media such as Makongi agar. According to work INVIC test for confirmation of infection. From biochemical test that confirmation infection with genus of Enterobacteriaceae include oxidase test. Procedure. Place 2 to 3 drop of oxidase reagent include 1% tetramethyl paraphenyl diamine on filter paper or petri dish. Mix with microorganism on petri dish or filter paper. A positive reaction is indicated by appearance of dark purple color on paper within 10 seconds. Among the gram-negative rod, Vibrio, Aeromonas, Pseudomonas, and Alkali genus are oxidase positive. Note: all Enterobacteriaceae are oxidase negative.